Please welcome our next speakers, Lisa Gray and Dr. Ann Runkle, as they present a deep dive on Pediatric Readiness Toolkits. As always, please post any questions or comments in the chat and we will address them at the end of the presentation. Thanks so much.
Hi, everyone. Thanks so much for joining us. My name is Ann Runkle, and I'm a Pediatric Emergency Medicine Fellow at Cincinnati Children's Hospital and one of the fellows on the Pre-Hospital Pediatric Readiness Steering Committee. I'm one of the many people who helped contribute to the Pre-Hospital Readiness Toolkit, and I'm really looking forward to discussing it with you today. I'd also like to introduce Lisa Gray, the co-lead for the EIIC Trauma and Hospital domains, who will be talking about the hospital-based toolkit. So an overview of our talk today. First, I'm going to talk about the background that led up to the development of the toolkit. Then I'll give an overview of the pre-hospital toolkit, as well as a detailed walkthrough. After the walkthrough, I can discuss any questions you have, as well as any suggestions for additions or future directions. And after that, Lisa will do the same for the hospital-based toolkit. So the foundation of our current PEDS Ready work was in 2003, which was the initial national assessment of US EDs and their preparedness to care for children. The results showed that most hospitals were unaware of current guidelines and often didn't have essential pediatric equipment or care policies in place. In 2006, the Institute of Medicine used these findings to publish a report commenting on the gaps in our emergency care system to be able to care for children. The results showed they recommended, based on their findings, that there should be national guidelines to improve the emergency care of children. 3 years later, AAP, ASAP, and ENA released a joint policy statement with guidelines on the care of children in the emergency department. To help implement these guidelines and assess the current pediatric readiness, the National Pediatric Readiness Project was created in 2013, and in 2013, they released the hospital-based toolkit to provide resources for PECs and EDs for implementing the checklist and improving their ability to care for children. This was followed in 2018 by the launch of the Pediatric Readiness Quality Collaborative, which had the goal of assisting state programs in implementing specific interventions. So as we continue to make significant progress on hospital-based pediatric readiness, the next area for improvement was the pre-hospital setting. So in 2019, the Pre-Hospital Pediatric Readiness Steering Committee was formed, and their work led to the 2020 publications of both the policy statement and the technical report on pediatric readiness in EMS systems. So now that we have a guideline, how do we improve pre-hospital pediatric readiness? So the first step in 2020 and 2021 was the development and rollout of a checklist of recommendations based on the initial report. So the next step after that was the creation and rollout of the toolkit that will provide resources to help PECs, medical directors, and EMS agencies complete the checklist and improve their ability to care for pediatric patients. So our goal with the toolkit was to find the best, most reliable resources to correspond to checklist elements and to have them all in one location. So if a PEC or a pre-hospital provider wants to find a video on a specific pediatric skill or find an example protocol for pediatric seizure, they can come to the same central location for their resources rather than having to look at different locations around the internet for possible resources or inspiration. So gathering all of these resources was a huge team effort with over 20 toolkit subcommittee members contributing. And it's our hope that this is still a work in progress and we can continue to grow our toolkit as high quality pediatric resources are developed. So moving into the future, we are planning over the next years to develop a sustainability plan for the toolkit to make sure that it grows over time and we incorporate new resources and respond to the needs of our pre-hospital providers and PECs to provide them with the best possible resources. And then after this toolkit has been available, the final step is going to be disseminating the assessment in 2024 to gauge what the current state of our pre-hospital pediatric readiness is. So our goal is First the checklist, then the toolkit. So we want people to be as prepared as possible for the assessment in 2024. And the goal of our toolkit is, again, it should be ideally kind of a living document where we can add and remove resources responding to the needs of the community. So the pre-hospital checklist and toolkit have the same domains. So there's 7 domains. So you have education and competencies for providers, equipment and supplies, patient and medication safety, patient and family-centered care, policies, procedures, and protocols, quality improvement and performance improvement, and interactions with systems of care. So I'm going to stop talking about the toolkit now and actually show it to you, which I hope will be more interesting and can generate some questions. If you'd like to join on your phone, there's a QR code that will link to the toolkit itself. And Rachel's going to put a link in the chat for people who want to join on their computer instead. So just to start with, I'm going to show you the checklist and the toolkit side by side, just so you can see how they correspond pretty directly, so that somebody who is, for example, a PEC or somebody in the EMS agency in charge of education can look specifically at the checklist and say, oh, hey, I don't have any great resources for teaching pediatric airway management. Let me go over to the toolkit and see what resources are available, rather than having to hunt that down and say, look for YouTube videos or podcasts or book chapters or a bunch of different resources. Instead, they could come right over to the toolkit. So, for example, looking at the first domain in the checklist, you have education and competencies for providers. And the first area they have here is psychomotor skills. So that's specific procedural skills. And so if you jump over to the toolkit here on the left side, the first thing that will show up is education and competencies for providers. So if you go and click on that section, you are going to see it divided into the same 3 areas that the checklist is divided into. So psychomotor, cognitive, and behavioral, just to make things easier to find. So for example, say you wanted to find a resource on airway management, you would go into the psychomotor skills and look through kind of this curated resource for specific psychomotor skills. And you can find that we have airway suctioning, and then you can use that as your resource. For example, for fluid therapy, you have a push-pull rapid fluid administration video. Intranasal medication administration, we've got a video on that. So kind of looking at these resources in general, you can also sort, say you're looking for videos specifically on using a Broslow tape, you can sort by video to say, like, what resources do we have that are a video specifically? You could also see there are some of our resources that are web pages or practice guidelines. So if you're quickly looking at this, you would say, okay, we have 2 resources here on intranasal medication use, but one of these is a 4-minute video on how to administer intranasal medications. The other one is a 6-page guideline that would be more specific literature on what medications would be safe to use intranasally in pediatrics. And for some of these, so I neglected to mention at the beginning that this website is all Rachel Alter's work. She's put so much into this. And one of the things that she did here is, instead of having to like look through this 13-page document for where there's specific intranasal medication resources, it will say here, you can please refer to pages 8 to 13, for example, so you know what page to go to. Going through all of these, so another thing you'll notice is that there's details on all of them. So for example, using a length-based tape, you get a kind of a summary of what the video will be, and also who the resource is from. So for example, using a length-based tape, this is from Children's Hospital, Colorado. So if I were to click on this, see, so it's a brief 7-minute video on how to use a length-based tape. Other things to know about the general layout of the toolkit is that you can sort things by who it's relevant to. So basically everything in the toolkit should be relevant to pre-hospital providers, but some would also be relevant to nurses and clinicians who may be ED based. The one thing that is still a work in progress is ideally every single time you come to this website, your resources would be laid out in the same way. For example, you'd find length-based tape at the top. Right now, kind of the only options are most recently updated in alphabetical. We're working to add kind of a more permanent order so that you can reliably find your resources. The other thing that you'll notice here is that there is a suggestion box right over here on the left. So if you come in and you say, oh, like I saw this really great free access video on pediatric intubation or pediatric bag valve mask skills, and I don't see that here in the toolkit, you can always hit the submit content box over here, and you'd be able to send that tool to the toolkit committee. So now that that's kind of just an intro, I'm just going to do a brief walkthrough of the different sections that are available in the toolkit. So going through again, if we go back over to our checklist, you have in the education domain, you have cognitive skills and behavioral skills. So for example, for cognitive skills, if you click on your resource there, you have multiple different skills, cognitive skills that were mentioned in the checklist. This is a really great resource for assessment of pediatric patients, as well as specific simulations. So for example, if you wanted to do a simulation for certain mass casualty incidents, those are going to be here. And if you click on them, you'll be taken directly to the website with the learning objectives and the simulation itself. We also have modules here specifically on identifying child abuse, the SimBox EMS, which is a fantastic resource that allows simulation for pre-hospital providers that entirely done virtually. And then also another resource here that I want to highlight is this, it's an interactive module, but it's actually an entire EMS course through University of Colorado hospitals. So this is a completely free course that goes through pregnancy, but also infancy and pediatrics. So if people follow this link and enroll, they're able to get some really fantastic videos on neonatal care, pediatric pathology, and interventions. So going back to that, again, we let you know kind of in the details of the section what you're getting into. So for example, here, you might just say, oh, what's emergency care? But if you take a look, it's actually 39 videos. It takes you about 4 hours to complete, and you've got 14 readings. Other things we'll have here are things like kind of policy statements on handoffs and other assessment tools. And going back through the last one, so the final subsection of the education domain is the behavioral/communication skills. And this is where we have a lot of resources on communication with pediatric patients, managing frightened children, children with special health needs, and also specifically resources on disparities in EMS and healthcare, as well as cultural competence. And then you'll also notice that for some of these resources, so if we go back here, for some of these resources, you'll notice they fall into multiple different document types. For example, managing the frightened child, that's a really great resource. It is an article, but it also has embedded videos. So if you wanted to teach, for example, like tips and tricks for dealing with frightened children, you have an article itself, but there's also embedded videos that you could show at an education conference. All right, so that was the first one. That's kind of the biggest deep dive since it was the introduction to the toolkit. I'm briefly going to go through each of the other sections just to show you what's available. So the next area of the checklist is equipment and supplies. If you click through here, this is relatively straightforward compared to education. You basically have recommended equipment, recommended products, and then what you have is equipment checklist examples. So we went through and curated some resources from specific states for both BLS and ALS equipment checklists specific to pediatrics. So if your EMS agency were working to develop one, these would be some great resources to start with. And again, you can definitely suggest content here. And this is going to be part of our toolkit development process, is kind of constantly refining things. Like we don't need an equipment checklist from every state. A couple of like really high quality ones are enough. But if you were to find, for example, a checklist that addressed an aspect of pediatric care that was not addressed in these 5, that would certainly be something that could be added to the toolkit to improve it. So the next area of the checklist is patient and medication safety. Again, going through here, we have a couple of great categories of resources. This one is more straightforward. It's focused on safe medication dosing and safe transport. So under safe medication dosing, we have a great lecture on volumetric dosing and its potential for reducing errors in pediatric medication administration. But then we also have several different states and their volumetric dosing cards. So for example, if you're EMS agency or kind of a state program, we're working on making volumetric dosing aids for your ambulances, this would be an example of where to look. For example, this one's from Colorado, I think if we look in the details. So this is from Colorado EMSC. This is their pediatric quick dosing reference. So if you click on that, you'd actually be able to download an entire spreadsheet of their medication doses for different weights. You could also take a look, for example, at Michigan's dosing cards and see how they did things differently. So again, we don't need to have every state here, but just having a couple of different ways to do it, for example, an Excel document versus a PDF, can provide your organization with kind of sources of inspiration, areas for possibly improving your current interventions and dosing cards. In here, we've also put some primary literature and articles on medication dosing safety, and also kind of ambulance personnel perceptions of near misses, so areas that could be potential QI areas for an organization when they are working on improving their medication safety. We also have in here some resources for safe transport of children and sample guidelines from several states on safe pediatric transportation guidelines, and guidelines and protocols. Moving into the checklist section on patient and family-centered care in EMS, there are specifically resources on communication with non-English speaking patients and family members, as well as family presence in resuscitations and with transport. So clicking on that section over in our toolkit, we have them separated into similar categories. So for communication tools, we have some resources for communication as well as language identification guidelines. And then under our guidelines and general resources, there's specifically a lot of resources for getting families involved, making sure that your EMS agency's care is family-centered, working with patient and family advisors, and then also just improving pre-hospital care and in communication. All right. We also have in here, we fit in here disaster preparedness and human trafficking. These are kind of areas that have significant overlap in the domains of the checklist and the toolkit. But for example, in the disaster preparedness section, we specifically have resources on family reunification following disasters and also potential tools for reuniting children with their parents after disasters. So moving to the next section, so this is a large one. So it's policies, procedures, and protocols. So clicking into this, what you'll notice is there's a few major sections. So first, there's policy and position statements, which is specifically a collection of position statements and policies and guidelines from ASAP, NAEMSP, and AAP, specifically in roles of medical directors in care for children, roles of state EMS medical director in care for children, consent, and out of hospital medical direction. So we have a whole section for policies here. Then we have a really large section for pediatric protocols and guideline resources. So this is a large section that we're going to be refining down into specific groups as we get more resources. But this, we have some examples here, for example, like pre-hospital destination choice. But some of our other resources will link you to pre-hospital evidence-based guidelines. For example, here, specifically giving you your topic and your reference, as well as websites with huge databases of EMS protocols, some of which are pediatric specific, some of which are not. And then our final category here is dispatch and pre-arrival resources. So specifically here, we have some examples, for example, LA County dispatch pre-arrival instructions, guide cards, and then specific pre-arrival and dispatch instructions for patients who are non-English speaking. So our second to last category is quality improvement and process improvement. So this is an area of the checklist that organizations may not be as familiar with. Some they may be familiar with, such as like your PI process, including pediatric encounters, pediatric specific measures, and like processes to track pediatric centered outcomes. So this really just serves as a resource for possible areas for QI and PI projects. So one major section here is the Ihi Improvement Resources. So that show them to a general toolkit, as well as the Ihi QI YouTube channel. And then we have here the NEMSQA pediatric measures, specifically estimated weight in kilos, beta agonist for pediatric asthma, as well as pediatric respiratory assessment. So this could be a real jumping off point for organizations who are looking to develop pediatric specific quality improvement. And our last section of the checklist is interactions with system of care. So here specifically are the categories of mental health care, disaster triage, mass transport, family reunifications, and understanding local and regional capabilities. So here again, we have this separated into several sections. So mental behavioral health, we have handoffs, transfer of care, disaster preparedness, and human trafficking. So for mental behavioral health, this specifically is mental and behavioral health for EMS providers. Kind of our bereavement resources for families, we're in the family-centered section of the toolkit. For disaster preparedness, here we have more resources than we had in the earlier sections. And again, this will be family reunification, but also multiple different kind of disaster-centered scenarios, such as pediatric disaster triage with the Jumpstart method, planning for disasters, and then checklist tools, as well as games that could be used during education. And we finally have a section here on handoffs and transfer of care in the emergency department for kind of examining that interaction for pre-hospital providers. And then I haven't come across it here, but some of these resources that are interactive modules might require a password. If there are any that require a password or require certain permissions, we'll put it in the subtitle beneath the resource so people won't get frustrated going to a resource and not being able to access it. So that's the initial look at the pre-hospital toolkit and how to use it. I haven't been able to see the chat during the video, but I'd love to answer any questions you might have, as well as any suggestions for how to improve this and make it the best possible resource for our pre-hospital providers. All right, well, I'm going to turn this over to Lisa.
All right. Hello, everyone. My name is Lisa Gray, and I am a nurse by background. I just want to double check. Can everyone see my screen okay? Nope, I got a no. Okay, hold on just a second. Now we good? All right, we're good. So thank you, Dr. Runkle, for starting us off. And as I started to say, as she mentioned, my name is Lisa Gray. I am a nurse by background. I'm with the EIC, the hospital and trauma domains. But my nursing background is pediatric critical care and pediatric trauma. So today, many of you are familiar with the hospital-based ED toolkit. So I'm going to take a little deeper dive in that. Most importantly, get some feedback from you all to make this the most user-friendly, applicable toolkit for the hard work that you are doing. So again, just a little background, as Dr. Runkle mentioned, all of this work is based off of the policy statement related to pediatric readiness in the emergency department. Our toolkit very much outlines the 7 domains of pediatric readiness that are referenced in this policy statement, as well as and the checklist that you will see as well. So very similar, you will see a lot of similarities in some of the format between the pre-hospital and hospital-based checklists. Specifically, the document that you're seeing on your screen is the PDF or the hard copy, if you will, of the checklist, and it matches the domains of the toolkit that we have online as well. As I mentioned, there are the 7 domains that the toolkit is based off. You will see, I believe it's 2 or 3 additional resources listed in the hospital-based toolkit, and those include disaster preparedness, clinical evidence-based guidelines, and also an interfacility transfer section as well. So all based off of the 7 domains of pediatric readiness that are a common theme throughout all of the work that we do. Just like the pre-hospital toolkit, you can take a tour, an interactive tour while I walk through this by scanning the QR code on your screen. Also, Rachel has been kind enough to include the link in the chat box if you would like to navigate as well through the online site. All right, so we'll go ahead and start. I'm going to switch over to the web-based screen. So just like I mentioned, this is the PDF checklist that is accessible on our website. So as I walk through, you'll see that all of the sections very much coordinate with the checklist that you're seeing on the screen. So I decided to go ahead and start at the beginning of the landing page of the EIC website and walk you through that way, just in case you have a hard time seeing where the toolkit is located. So if you'll go under focus areas, then to the National Pediatric Readiness Project, and right here on the right-hand side of the screen, you will see Readiness Toolkit. So we'll take a look there. Really, this toolkit is a really comprehensive, dynamic set of resources that was compiled by many subject matter experts, as well as members, renowned members of our collaborating partners, AAP, ENA, NSIMSO, ACEP, American College of Surgeons Committee on Trauma. So a vast amount of experience in folks who are taking care of all aspects of the pediatric care continuum. So these recommendations really apply, the recommendations and the resources from the toolkit really apply to any emergency department, whether you're working in a small, rural, critical access hospital, possibly is your emergency department setting, anywhere to bigger centers, big academic university level centers, or emergency departments. These resources are really for everyone. So before I begin kind of going through the toolkit content itself, if you scroll down to the bottom of the screen, you will see that there is you can download the checklist here. And then we have also an additional, it's called an interactive checklist. And I'll explain that a little bit more towards the end of my presentation as we walk through, because it looks a little bit different than the traditional checklist and is not as comprehensive, but is a resource that many folks like to have. So scrolling back up to the top, just a few differences that you've seen from the pre-hospital toolkit. We're not set up by persona yet. So your specific area of expertise isn't noted yet. So this is really, you can't click through according to nurse, pre-hospital, so on and so forth. This is a general setup. The hospital toolkit did precede the pre-hospital toolkit by many years. And we are, as time has moved forward and lots of folks are putting a lot of time and effort into making our website more user-friendly, you will probably see changes coming in the future that make the setup look very similar to our pre-hospital checklist. Our search function isn't quite as up to date as the pre-hospital toolkit, but you can still type in areas or type in keywords in the search box and go to specific resources that you are looking for. Just not as detailed as, like I said, the pre-hospital one. Again, for this particular toolkit, we do have a bar for you to provide feedback. I know, so I'm fairly new to the EIC. I've been here a little over a year, and many of you have already done just that, provided feedback to myself and many of my colleagues within the EIC to make some changes, brought to attention some links that aren't working, and we really, really do appreciate that feedback. I encourage you to continue to do so. And as we work on improvements, it's always nice to hear from you all, the folks that use the toolkit, to make sure that we have everything set up and is easily accessible for you. You'll see that many of the resources in the hospital ED toolkit are more generic and frequently have currently been vetted by those subject matter experts and organizations that I mentioned previously, and they aren't as institution specific. They're, in fact, most of them, the majority of them are not institution specific. Our really intent is to provide resources that are user friendly for everyone and have more of first of all, we want to ensure that they're evidence based. But we also want to make sure that they're a generic resource for anybody to use and aren't necessarily institution specific. You will see a few examples that are so, and that's good. Many folks want that very detailed, specific example of an institution, but for the most part, you'll see that everything's pretty generic. So at this point, we'll go ahead and dive a little bit deeper into each of the sections. So really, again, order is set up just by the order of the checklist and order of the areas or the domains of pediatric pediatric readiness. And this first section really does focus on the PEC. So what do we know about the PEC? They're instrumental in preparing emergency departments to be hospital ready. This particular section gives multiple resources on, number one, how important it is to have that PEC role. As I'll click on some of these links, many of them open into Word documents or PDFs, or perhaps even sometimes videos, but specific documents that really highlight the importance of that PEC role. So I won't go through all of these, but just as an example for you to see what those look like as you click on them. So the importance of the role, roles and responsibilities of a physician PEC, as well as roles and responsibilities of a nursing PEC. Each of these sections also has specific examples of credentialing and guides you to websites for example, I'll use nursing specific, for certifications for your certified emergency nursing certification, your certified pediatric nursing certification, so on and so forth. Again, some general resources and webinars. A nice webinar here we have from some of our experts, a couple of our experts in pediatric readiness. So always having those available. And then a sample elevator pitch for pediatric champions. This is really a resource for you to share with your colleagues, share with your leaders of your organization why PECs are so important. I'm not sure if I mentioned at the beginning of my talk this, and I know that Dr. Runkle did. This toolkit really was incepted, I guess, if you will, back in 2013, 2014, and then revisions were most recently done in 2019, 2020. So the majority of all the materials that you see have been recently reviewed and revised by our subject matter experts and Nprp steering committee. So I forgot to mention that. I wanted to go back and make sure I covered that. So this is really this section, again, administrative function, the importance of the role of a PEC. Each section, as you will see, also expands and closes, looks a little different from the pre-hospital toolkit, but pretty user-friendly and straightforward. This particular section is more about competencies and not necessarily competencies, excuse me, resources for competency checklists. What should be included in staff competencies for each discipline. You'll see some of these as I click here. Again, going back to a specific document. So you have the luxury of being able to print those off if you will. And this is one of those resources that is institutional specific, but a nice resource for anybody to use and replicate. We know we're very fortunate in the pediatric world that many of our colleagues, most of our colleagues are so very willing to share tools and guidelines, policies, checklists, anything that have been previously developed. We know that many are always willing to share. A handoff tool, also a very important piece of utilization to have during pediatric care. So that particular link directs us to IHI and a nice resource on a SBAR tool. We'll close that section. Moving on to quality improvement and PI in the emergency department, you'll see that this section is a plethora of resources related to the QI process and integrating a QI plan in your emergency department. So again, very specific resources around rapid cycle improvement, rapid quality improvement science, so on and so forth. I won't click on each of these details. Again, a webinar in this section. But again, just wanting to make sure that you know that these particular resources are here and you have the ability to access them in a very easy manner. Once again, I'd like to reiterate here, if there are resources, particularly in this section, that would be of benefit for you, especially around QI. We know that developing quality improvement plans and process improvement plans in pediatrics is sometimes challenging. Again, one of the many, a big focus on many of our collaboratives within the EIIC. So please take an opportunity to look through this section and provide us feedback and what additional resources may be helpful for you. Moving on to policies, procedures, and protocols. This is a large section, but again, goes through many of the areas of pediatric care and gives examples of each of these areas to help folks implement policies, procedures, guidelines. Many of them redirect you to a different area, but again, many resources available to open, share, utilize for the development of protocols, procedures, so on and so forth. So you can see as I click on those, each of those sections expands. So assessment, documentation of vital signs, immunizations, sedation and analgesia, many resources on consent, social and behavioral health, physical and chemical restraints, especially useful during times of pandemic as we see uptakes in these vulnerable patients presenting to our emergency department, child abuse and maltreatment, death of the child in the emergency department, do not resuscitate orders, family-centered care resources, communication with primary care providers, medical imaging. We do have a section coming soon on children and youth with special healthcare needs, telehealth and telecommunication. I don't want to click on each of these, being mindful of time and plenty of time for question and answer at the end, but I wanted to just walk through them briefly so that you know that they are here. Most of them, as you can see here, are PDF documents or Word documents on this particular resource. All right. So we headed through those. You can see if you click on each of them or click on one particular page, it will take you through the plethora of resources there. Disaster preparedness. Again, being mindful of time, I won't click through each of them, but lots of resources from our folks in the disaster domain of the EIC. So easy and at your fingertips. Clinical-based evidence guidelines. Some PCARN publications. Many of us use the PCARN rule in our emergency departments, so those are right here at your fingertips. Interfacility transfers. I want to go ahead and make a mention here. Our interfacility transfer toolkit is noted in this section and is currently under revision. You can still access the interfacility transfer toolkit here, but it is under revision, so you will see updates coming soon to that. Patient safety, again, the Braslow system, resuscitation, calculations, code cards, key points on medication errors, lots of nice resources around patient safety in this section. And then last but not least, supplies and equipment. This particular section takes you right back to the checklist, which if I scroll down here, you'll see is very detailed on specific lists of medications, sizes of equipment, very detailed description of all the supplies, equipment, and medications that you will need to appropriately care for pediatric patients in your emergency department. So I think that's it as far as a quick walkthrough. I'll go back to my PowerPoint really quickly and mention the interactive checklist. I know that many of you do like to use this interactive checklist. And I just want to note the caveat here that this interactive checklist looks exactly like the full comprehensive checklist, except it's only those areas that have an interactive link included in them. So I'll go ahead and open it here. You can see it's only the areas of the pediatric readiness checklist that have links. So it is not a comprehensive list. I want to make sure that everybody just in case you think, oh, here's the interactive checklist, it's the comprehensive ED checklist. It is not. It's only those resources that have an interactive link. Some of them, in fact, link you back to the toolkit on the EIC website. Some of them have organization specific, but I know many of you use that, so I did want to take the opportunity to address that really quick. All right, and last but not least, as I mentioned, we certainly want your feedback. So I have included a QR code that that links you back directly to our hospital-based care improvement, or our hospital care domain, which is the email address that we monitor for suggestions from the toolkit. So please take a moment to keep that feedback coming as you work through. If you find any links that aren't working, if you have suggestions and think of specific tools or resources that would be helpful for you taking care of your patients in the emergency department, please get that back to us. We are very, very willing to put that through our vetting process and make sure it's good for all and applicable to all folks, but we welcome that feedback. And at this time, I will stop talking and thank you again for everything that you all do every single day for our pediatric patients. And Hannah will moderate the chat box for us and direct questions back to Dr. Runkle and myself.
Thank you, Lisa and Dr. Runkle, for your wonderful presentations. Looking through the chat here, looks like Rachel was able to address a lot of the questions. There was one comment. Lisa, can you talk about how the Nprp steering committee vets the resources included in the toolkit?
Yeah, so we're working on that process. So many of our Nprp steering committee folks are members of our collaborating organizations with the EIC. So specifically those that I've mentioned: AAP, ACEP, NISMSO, ENA, and American College of Surgeons Committee on Trauma. So we really start with that committee and then also include subject matter experts to ensure that resources are evidence-based and are available and peer-reviewed through literature review and so on and so forth. So a rigorous process that we are actually even working on now in making sure is more uniform across the pre-hospital space and the hospital domain space, but certainly vetted through many different channels. Wonderful, thank you. Looking here to see if there's any additional questions. Thank you everybody for your participation and your comments. They have been noted. I'm going to give everybody just a few more seconds here. It looks like we have 2 minutes. Looks like Renee has a question. If we have questions about items listed on the ED checklist, who may be the most appropriate person to reach out to for clarification? You're welcome to reach out to me. And if I don't know the answer, I will share it with my colleagues and we will certainly get an answer to you. Wonderful. Thank you, Lisa.